This is one of my favorites, Body Keeps the Score. It really blew my mind the first time I read it. It's about trauma. Why do so many of my patients with ADHD have trauma? I'm not sure, but I do know one thing. ADHD is a diagnosis that came after stimulants were put on the market. Stimulants, namely amphetamine, was manufactured in the late 30s. It was actually on the shelves at the pharmacy. Doctors would prescribe stimulants for everything, depression, weight loss, fatigue. But eventually, in the 80s, attention deficit disorder appeared in the DSM. We know it as attention deficit hyperactivity disorder. But really what it is a label that helps us identify who's going to be a candidate for stimulant medication. So we know what stimulants are really bad at treating, and we know what stimulants are good at treating. Attention, being able to stay present, stimulation. In the DSM-5, attention deficit disorder is a neurodevelopmental disorder, meaning at some time during the development of someone's lifespan, this issue arises, an issue that I know is very real. How? Well, it wasn't until I was 17, the first time I took Adderall, my brain turned on. I felt calm, and I remember thinking, what am I doing with my life? And the medication helped me a lot. It helped me graduate high school, and then, of course, as a nurse practitioner working in an ADHD clinic, I learned how to take my own advice. Here's the thing. Not everyone responds to ADHD medication. ADHD is a good label, but the stimulants came first. So, with a neurodevelopmental disorder, we think of it like this. Sometime during development, the brain doesn't have a consistent level of dopamine. So therefore, we become reliant on external stimulation. There's a lot of theories about the pathology of ADHD, but at the end of the day, you're capturing a group of people that are going to respond to this medication. It's how they are now. But the question is, how do we get there? I had a major transformation, and I applied all these behavioral skills and transformed my life. I really became passionate about ADHD treatment. I blogged about it for some time, and I compiled those blog posts into a book. Link in the description. But at any rate, patients would shut down. So many patients were stuck. So not only did not every patient respond to the medication like I did, but more so, not every patient was able to experience the behavior changes I did. It was confusing. Why me? How come I'm able to change my life and other people weren't? Well, flash forward to 2023 when I realized that my mother has narcissistic personality disorder. Now, I'm in psychiatry for a reason, but why is it that 75% of my patients also have a similar experience? Meaning attachment issues. So if we're going through development and we're experiencing chronic stress environmentally, then can that lead to ADHD? Can we pass down generational trauma? Does it even matter? I'm not sure. But I know one thing, ADHD and trauma aren't talked about enough. Just thinking out loud, but let me know what you think. Man, thanks for joining me. This is Jonathan Murphy, psychiatric nurse practitioner. I'll see you next time.